Hello from the small window on your screen. This is Adam Turtletail from the Healthcare Compliance Association. I'm joined today by Darrell Conteras, who's the Chief Legal and Compliance Officer for Plus Delta Technologies. Darrell will be speaking at the HCCA Clinical Practice Compliance Conference, which will be taking place October 13th through 15th in Philadelphia. Darrell's here today to give us a preview of his general session talk, HIPAA, the New Era. Darrell, thanks so much for joining us today.
You're welcome.
What are some of the key developments in HIPAA that compliance professionals need to be aware of?
Well, the omnibus rule went into effect September 23rd. It was published in January, but goes into effect on September 23rd. And in our session, we're going to inventory the list of the items that changed, but we'll highlight a couple of the key changes. Among those is the change to business associate liability with regard to subcontractors. Subcontractors are now basically responsible for complying with the HIPAA privacy and security regulations, and business associates are responsible for the conduct of their subcontractors. We'll also discuss the changes to the breach notification requirements. The standard for breach notification prior to the omnibus rule was viewed in a lot of ways as covered entity beneficial. In other words, you really had to have a breach based on a risk assessment in order to trigger notification. The new rule has a presumptive default for reporting breaches where the old one did not. There's also some changes to the notice of privacy practices that we'll review, and then some other restrictions. Key among those would be probably the one that's getting a lot of attention is the notification to health plans for people who opt to pay for a procedure on their own and choose not to have that reported to their health insurance plan. For a lot of clinical providers, they're going to have to figure out how to keep that documentation separate so they don't provide that notification to health plans. The other component that we'll touch on in the session that doesn't necessarily come from the omnibus rule, but it's been a bigger issue, is the OCR audit and review process, where they started to look more at entities and what they're doing to get ready for compliance. And then, of course, as part of that, we're going to discuss how to mitigate for that risk, meaning how do you prepare for it? What can I look at today to be ready for an audit if it were to come around later on?
Interesting. So what are some of the more effective ways for compliance people to start addressing these issues?
The first thing is to get an understanding of what is changing and what's going into effect on September 23rd. Once you have that idea, then it helps to put that in the context of your organization to know what risk may actually impact you. Some of the ways that people do that is, number one, you take a look at what OCR has published, and they've published a template which has kind of their risk assessment. It's basically an audit template that they've put together. I'd recommend, and I'm going to recommend in our session, going through that, and I provide the citation for that in our session notes, because you want to know what they're going to look at so you're comfortable with it. Beyond that, the OCR is expecting each organization to put together a risk assessment of the risk areas that are specific to them with regard to protected health information, or PHI. So what we've been doing as an organization internally is we've been putting together kind of risk assessments on specific things where we're concerned or we have a question about whether the PHI is truly protected. And I'll encourage people to do that as well and kind of walk them through the process of how to do that on their own.
Sounds great. Thank you so much for your time, not only just for doing this, but in putting together this talk. And look forward to having you at the Clinical Practice Compliance Conference, October 13th through 15th in Philadelphia. I'm Adam Turtletail from HCCA, thanking you again, Darrell, for joining us, and thanking all of you who took the time to watch this video.